Hello, everyone. Welcome to the IJD podcast. We're the official journal of the International Society of Dermatology. I am Lily Becke.
And I am Anita Biro. We are the editorial managers of the IJD. In this podcast series, we'll spotlight the dedicated professionals who help shape our journal, including section editors, selected reviewers, and authors.
Stay tuned for a closer look at the people behind IJD.
So, hey everyone. In this podcast episode, my guest is Professor Jacek Szepietowski, the Deputy Editor of the International Journal of Dermatology. He will share his thoughts about the journal and about the society. But first, let me introduce you Professor Szepietowski. Jacek Szepietowski is a full professor at the Division of Dermatology, Venerology and Clinical Immunology at the Faculty of Medicine, Wrocław University, Poland, and at the Department of Dermatovenerology in the 4th Military Hospital in Wrocław, Poland. He is the president of the Polish Dermatological Society and the past president of the International Forum for Study of Itch and the past president of the European Society for Dermatology and Psychiatry. In the past, he also served as the vice president of the International Society of Dermatology, chair of the Educational Committee of the ISD, and he was also an executive committee member of the EADV, chair the project proposal and review committee of the EADV. His main research interest is concentrates on itch, psychodermatology, and chronic inflammatory skin diseases with special attention to hidradenitis suppurativa. He was awarded with the honorary membership of 22 international and national scientific societies, Hermann Musaff Medal for outstanding achievements in psychodermatology, and IRDS Certificate of Appreciation for International Leadership. So, hey, Jacek, I'm so happy to have you in our podcast episode.
Thank you very much for your invitation, Lajos, and thank you for the lovely introduction, and I'm happy to be with you today.
Yeah, thank you very much. As we have heard, you were really highly active in the society as a vice president of the society and chairing the educational committee of the ISD, and now you are the deputy editor of the journal. So you are really highly active in the society and also in the journal. What was your motivation for many, many years ago to join to the ISD and now to join to the editorial board as a deputy editor?
The International Society of Dermatology is a very specific society. It's of course international, as you can have just from the name, but anyway, it's very important that it opens a platform for everybody, not only highly developed countries, but also just the developing countries. So this is a society, a unique one, because we know about the European Academy of Dermatology and Venerology, grouping mainly just the colleagues from Europe, the American Academy of Dermatology, just mainly for the colleagues from the United States. But here you have the possibility to collaborate with different colleagues, having also the different resources for the research, for the education. And I think it's fantastic because we can help each other, we can learn a lot from each other. And this is just a society which gives you a lot of opportunities, because the mentorship program, I love this program. I accepted several mentees just to join my group to work in different areas. So that's
Could you tell a few words about this mentorship program? Maybe not everyone knows this program.
Oh, yeah, that's very important program, and probably many young colleagues, they are joining the society because of this program. And this is a program that is offered by the Special Committee of the International Society of Dermatology, and the young people, the residents, but also the young dermatologists can go to the very well-known centers to spend a few months there. If I remember well, up to 3 months, that's the possibility offered by the International Society of Dermatology. And of course, that's a fantastic opportunity. And I had such mentees, for example, from Ethiopia. They were working in my department in the field of dermatosurgery. And after the training, and that was a little bit longer training even, because they continued till 1 year, but everything started with the International Society of Dermatology. They were first free dermatosurgeons in the countries. So you can see that this is a really unique opportunity to obtain the clinical mainly skills for young people from all over the world, and also the personal contact between the mentor and the mentee is of great importance.
Yeah, and Jacek, tell me how to apply for this program. If somebody wants to become a mentor or a mentee, how can figure out where to send the application and how to become a mentor or mentee?
This is an easy procedure, and everything is described just on our webpage. So I will encourage both the more experienced colleagues and the young colleagues to look at the webpage. And there is a special deadline for the application. And the person who is applying to be a mentor must, of course, fill a special form and be accepted by the committee. But then with the deadline, the applications are coming, and this committee is reviewing the application. And the most important is in this review process just to evaluate not only the candidate, but evaluate the value the candidate can bring to the own country, and to start, for example, new therapeutic procedures or the new diagnostic procedures. So that's a goal. So have a look just at the webpage. Once a year, there is a deadline for the collecting the applications, and definitely you will have a lot of not only fun but also fantastic experience.
Yeah. Thank you. I also encourage all the colleagues, experienced one and the mentees to check the website and to be active in the work of the society. And returning back to the journal, as deputy editor, what is the most challenging part of this work?
First of all, we should say that working for the International Journal of Dermatology is a great pleasure, because we are talking about the prestigious journal. So that's not only the journal of the society, but that's really just a highly ranked international journal. And I'm not really paying attention to the impact factor, but if you just consider the Q1 part, and we are so happy that the journal is in Q1. So that means in 25% of the best dermatology journals, definitely it gives you just also the pleasure to work for such a journal. It's not only the pleasure, but it's also an honor. Why we are all working for the journal, and especially you. And I've been in the field, in the research for more than 30 years. And of course, everything is based on the published papers. So someone must work as a reviewer, and we are also submitting the papers as authors. So if we are not involved in the reviewing process, in the editorial board, how can we expect to have just our papers proceeded by the editorial boards? So, of course, we are not paid for it. That's a voluntary work. But anyway, we should do that. And I think that that's also a kind of obligation of the senior person, let's say any expert in his or her field, or just to do the review and to contribute to the journal, because our just careers also just were based on the published papers. And in the past, someone else did the same job when our just papers submitted as young investigators were evaluated and assessed. So I think this is a part of our normal, regular work. And I think that just working as a deputy editor is also the challenging, because that's a lot of work. and you dedicate your time to the journal. Especially for you, Lajos, that's a hard work, and probably it's not a part-time, but more than full time job. And we are very happy that we have so many articles submitted to the journal. But having a journal as an International Journal of Dermatology, we are receiving the articles from different countries from all over the world. And the selection of the best articles is also a challenge. So the first selection and the decision of the further proceed with the review process. So this is also the hard work, and now we are challenging a lot of situations because having a good review process is very, very difficult. And that's not only for this journal, but I think that for all the journals, it's very difficult to have good reviewers assessing the papers because we have so many journals nowadays. And if you compare to 20 years ago, that's a completely different situation. So every day, you, me, we are receiving a lot of requests to review the papers. That's not possible to accept all of them. But anyway, if you dedicate it to the specific journal or journals, definitely that's worth doing this.
Yeah, in the last year we received more than 4,000 manuscripts to deal with, and it's really a hard job for everyone who is involved in the editorial office and in our editors. And having realized that this time limit and time pressure for everyone, we introduced a new system. We introduced the junior editor position in the journal. And you have also a junior editor, Piotr Krajewski. How do you see this direction? Was this helpful for you, or what is your feeling on that?
That's very helpful, definitely. And I think that was a very good decision to have junior editors. And you know that the other just journals are doing similar things. And some journals opened the call even for the junior editors, like the Journal of the European Academy of Dermatology and Venerology. But for me, it's very helpful. But I do hope that it's not only helpful for me, but it's also helpful for the younger colleague. And we are working on a daily basis together. And of course, it's not that every work, the whole work is done by the junior editor. We need just to discuss the issues. We need just to make our own decisions. But even from the technical point of view, it's very helpful. And the younger colleague is obtaining some experience in the editorial board. And definitely, especially with Piotr Krajewski, I'm very happy because he's a young person, but publishing a lot. He has the total impact factor of more than 300. So that's really just impressive for a younger colleague. However, just to be sure and to say honestly, last 2 months, that was a little bit more difficult because he's finishing the residency and he needs just to study hard. And hopefully that will finish in 2 weeks' time, and that will be even better to work with him after finishing the residency and definitely the passing the final exam. But anyway, it's a very nice option for both sides, and I think that beneficial for the journal.
Yeah, I think that this is a learning curve also for the junior editors. They learn how to evaluate a manuscript, and thereby they will write their own manuscript much better, and probably it will be accepted by other journals more easily if they know what are the tasks of a reviewer and the editor, and they learn how to deal with the manuscript. What are the main key issues? What should be evaluated in a manuscript? So they are our future editors.
This is what I wanted to say, that they are just learning now, but definitely this is a group of people that could replace us in the future.
Yeah. Going back to your own research and in dermatology in general, what do you think? What were the major breakthrough in dermatology? And could you tell a few words about your own research, especially on those ones you published recently in our journal?
So I had the pleasure to publish a few papers in the International Journal of Dermatology, and I usually consider this journal having a good stuff to be published or to be considered for the publication. As you introduced me, you mentioned that I'm working in three main fields. With several colleagues. That means each psychodermatology and also the chronic inflammatory conditions, especially in hidradenitis suppurativa. So if you work in the field, definitely you publish in this field, of course. So starting with the itch, I think that we publish an important paper on the readability of the itch documents in the internet. Nowadays, the internet is the main source of the information for many people from the general population, but also for the patients. And we tried just to analyze the readability of the documents with the term itch, with the term pruritus, and also prurigo. And we found that the pruritus was the most commonly used term in the internet to describe the itch sensation, followed by the itch and followed by the prurigo. And the prurigo is more specific term used by the professionals, used by dermatologists. But unexpectedly, we found that all the documents related to the itch, which is a very common symptom in general population anyway, are very difficult to comprehend. So it's difficult to understand what is written in the internet about the itch. The level is the level of the university, and of course, if you think about the prurigo, it's more difficult to understand these documents in comparison to the documents dealing with the itch. So I think that we should all work on it, and sometimes we dermatologists, we doctors, using their terminology, using the language which is really difficult for the general community to understand. That's important also for the education in future. Also, we paid attention to the artificial intelligence in the each research. And I'm very happy that the International Journal of Dermatology opened such a platform for this actual discussion, because it's a hot topic. And it, in my personal opinion, the artificial intelligence is definitely the future. It will probably not replace the human being, but anyway, it's also the dangerous instrument. And we should know how to use it, and how to use it having the benefit of the usage of artificial intelligence, especially in the diagnosis of the itch, which is a subjective symptom. I would like also to mention some issues related to the psychodermatology, because I am involved in several projects, international projects related to the psychoderm, based on the task force of the European Academy of Dermatology and Venerology, and also based on the European Society for Dermatology and Psychiatry. And recently we published a paper on stigmatization in hidradenitis suppurativa. So that's a overlap of both my interests, that means psychodermatology and HS, and we documented that there is a huge problem with the stigmatization in this group of patients. We know that's a terrible disease, of course, the devastating psychosocially. But anyway, this project was run in 17 European countries and found a place in the International Journal of Dermatology. And also, we are very happy that the position papers, the statement papers related to the quality of life assessment, both in urticaria and epidermolysis bullosa, were published in this journal. And I think that these are very good manuscripts and the papers which can have just a lot of citations in the future. Hopefully also just working in increasing the impact factor of our journal. I'd like also to mention one more paper which was related to trichotillomania, and that was a project which we ran together with the colleagues from Germany, from the group of Professor Diamant Tachi, and we used the TriNet database, which is a huge database of the patients, and this is mainly US-based database, but anyway, there are some European patients as well, and we looked at the treatment which are just applied for the trichotillomania patients, and of course we were interested mainly in adults, and unexpectedly we found that the real world is really very different from what is found in the guidelines, in the recommendations, in the experts' opinion. And we found that benzodiazepine derivatives were the most commonly used agents to treat trichotillomania, followed by the haloperidol, for example. And from the knowledge in psychoderm, we know that the antidepressants should be just the first line treatments, especially the serotonin reuptake inhibitors. So this kind of paper really underlines the need for education, the need for the education during the residency, but also during our regular work as clinicians. So I'm thinking about the continuing medical education that sometimes in the special fields, we need just to pay more attention to know how to deal with the patients, which are not typically our patients, I will say, but this is a kind of borderline between the psychiatry, between the psychology and dermatology. And especially in these borderline areas, we need more education just to have better just treatment, and more appropriate, I will say, treatment for our patients. And we are all working because we'd like to help the patients as much as we can, and using our best knowledge.
Yeah, Jacek, you are working really on hot topics in dermatology, and especially in the areas itch and prurigo and hidradenitis suppurativa. We had a huge breakthrough in the clinical care in the last few years. What do you think? What are the major challenges in patients' care in dermatology?
Yeah, that's an important issue, but we are very lucky, and I'm very lucky that I'm working in the field where there is such a development. But I would like to underline that we started the research in hidradenitis suppurativa more than 25 years ago, and that time almost nobody was interested in this disease because the patient was unwanted one, because there were no really effective treatments possible due to different organizational issues. There were not so many dermatology centers offering conservative and surgical treatment for this group of patients. I think that there were just three groups heavily involved that time. Nowadays, we have so huge interest in hidradenitis suppurativa because we have new treatment modalities, and I think that this is the also answer to your question, because the dermatology nowadays is a completely dermatology in comparison to the time we started, Lajos, working with our first patients. And the organization was very different of the wards. Also, the patients were just staying in the department for the very long period of time. Now we have a different dermatology, and we are so happy that all this basic research, which was conducted not only by us dermatologists, but also by the basic researchers, resulted in new treatment modalities. I'm thinking about the biological agents. I'm thinking about the small molecules like the JAK inhibitors. And that's very important also to understand that we are not talking in dermatology now only about the skin. We are talking about the whole human being from the psychodermatological perspective, but also because of the systemic inflammation, which is ongoing. So many comorbidities and comorbid disorders present in psoriasis, in vitiligo, in alopecia areata, in HS as well, and atopic dermatitis. So that's very, very different. So I think that we are very lucky that we are living in the time of such a huge developments, and the unmet needs are starting to be fulfilled. I will not say fully fulfilled, but at least partly fulfilled for these patients who are just very severely ill. And we all know that the dermatology is a specific branch of medicine. Everything is visible on the skin. And also, if you look at the authorities, we are not considered as important, that's my personal opinion, of course, as, for example, cardiology, as oncology. I understand these elements, but also using the quality of life measurements, stigmatization measurements, we are showing to our colleagues working in different branches of medicine that our patients are heavily suffering and they need the new treatment modalities. And also, this is important for the discussion with the authorities to have finances for our dermatology.
Yeah, in dermatology, we see a movement into the direction of cosmetic dermatology, especially for younger colleagues who just have the license from dermatology and then they move to the private sector and they are doing only cosmetic dermatology because they can earn more money in that field. What would you suggest to young dermatologists? Why to be involved in basic research and why to write papers and why to remain in medical dermatology instead of moving to cosmetic dermatology?
Yeah, I think that we will not escape from the cosmetic or aesthetic dermatology. And I do believe that there is a place for both aesthetic and also the medical dermatology in the whole dermatology field. But the balance is of great importance. And I also observed a few years ago that many young residents were mainly interested in aesthetic dermatology. Now, I fortunately see a little bit of switch, and still, and again, the younger colleagues are interested in, let's say, the medical dermatology. The biggest problem for me is the staff for the hospitals, because, of course, everything depends on the organization of the healthcare system. But in Poland, there is really no, the work in a hospital is not attractive for the people because they are earning more money working outside the hospital. They do not have the boss. There is a different responsibility, and they can just refer the patient to such institution like, for example, University Department of Dermatology. But anyway, someone must do this job, and it's it's very difficult just to encourage nowadays young people. And I think that the dermatology is a beautiful place where you can do many things together, because you can do the conservative treatment, you can do some surgery, and of course you can do a lot of research, including the immunology, because the immunological system of the skin is really fascinating, and it's the disturbance in it is a base for many chronic and acute inflammatory disorders. So I usually say to the colleagues that if they are involved in the research, they are obtaining a a different, perspective of the dermatology. And I personally think that having a background of the research, you are also becoming a better clinician. So the combination is really just perfect. You worked in the lab, I worked in the lab. Now it's a little bit more difficult, but anyway, I think that this experience I received in the lab, understanding on the process of the results from the laboratories you are just getting as a clinician, it's also a value. It's a value for the whole professional life.
Yeah, completely agree. And it was really good for closure, our discussion today. So thank you, Jacek, for being with us today and sharing your insights. Thank you.
Thank you, Lajos, very much. And we all wish our colleagues all the best in the research and in the clinical dermatology.
Yeah. Cool.
Thank you very much.
Thank you. Bye.